Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, everyone, and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager, and I'm your host. I'm here today with my friend, Dr. Chip Nguyen. Chip, thank you so much for being with us.
Thanks for having me, Bridge. Nice
I'm gonna-
seeing you again after
I know. We had an amazing trip we're going to tell you about. I first want to tell everybody a little bit more about you. So, Chip is a board certified family nurse practitioner. She has a doctorate in nursing practice degree and Cleveland Clinic certification. She is certified in functional medicine and has done IFM's full program and is board certified through them. She brings over 18 years of experience in primary care, urgent care, pulmonology, sleep medicine, aesthetics, and functional medicine. She was inspired by her own autoimmune disease, and this led her to focusing on addressing the root causes of health concerns for her patients, empowering them to reduce stress, feel confident, and achieve optimal wellness. Currently, she practices functional medicine with a leading hospital organization. She specializes in concierge executive health, advanced diagnostics, and personalized care for chronic disease management. And she is also faculty with us at the Institute for Functional Nursing. She is our expert in cardiometabolic health for our modules. And in semester 2, we are also doing a deep dive into how we can use physical exam findings in assessing our patients. And so she's supporting us there as well. And she is starting as faculty in our membership. So she'll be helping with our 4 meetings a month and our community space. So that is a little overview of our speaker today. I encountered Chip initially when I was seeking faculty to support us as we built the program, and that was last fall. And then Chip and I happened to both be at the Integrative Healthcare Symposium in New York City in February, which I did an episode on, kind of some takeaways from that trip. But I was hoping, Chip, if you could start by sharing a little bit about, I feel like we had such a great time in New York. It was a little quirky with the way things went down, but I would love if you could share a little bit about your takeaway from just being there and the experience.
definitely we had shared challenges. So there was some trauma bonding since the flight was canceled. I don't remember 4 times, Bridge, and couldn't get home. We were supposed to go home. I was supposed to go home Sunday, and
Mhm.
then my flight was changed to Monday, then Tuesday, then Wednesday, Thursday. But I got out Wednesday. We all did. But I just love seeing like the community together, having like-minded people, and know that you're not alone in this space. Because I feel like as functional medicine grow and you're stuck in a conventional model, you feel really lonely because no one thinks like you. So I was very
Mhm.
excited to meet you in person, Bridge, and Megan and everyone, because then we're able to like share our clinical stories and our experiences together and how we can support patients and even our students.
Yeah, there were a lot of really great conversations. Yeah, you're right too. I think we made the best of being stuck there during the blizzard because we
Yeah,
had some really great meals, we had some fun. But I think that our time at the booth and talking to everybody else and having our, like you mentioned, Megan was there too. We had students that were there. We had a lot of people coming up and talking to us about who we are and what we do and what functional nursing is. Chip says she's not good at sales. And I'm going to tell you right now, she's extremely good at talking to people. I think 2 things I learned about you during the trip is that you know everybody and you are a walking encyclopedia when it comes to functional medicine, anything. Like you are a
definitely.
resource.
I used to, when I was younger, I used to work in Costco. I used to stop people at the cell phone booths and talk to people. So I noticed that with our booth is I would just say hi. And a lot of people were really interested, but they were scared to walk up to us and talk to us. So I would just stop people and introduce our program and faculty. But I was really, really touched that a lot of different universities were asking for our help and a lot of different partnerships because it's the biggest, largest field, nurses, right? And it's changing rapidly, and functional medicine is going to be very big in the future.
Well, that was our first time having a booth. And I think once you're in our world and you're a nurse or a nurse practitioner, it's so obvious the problems we solve in the integrative space, but somebody just has to say it out loud or, point it out. And I think that the booth really did that where people walking by, you could really see them, what is this? And then be like, oh my gosh, this, yeah. Like, and the people we talked to, that was really a lot of the conversations were about, yes, we do need nurses in our clinic, or, oh my gosh, I am overextended. And as the provider doing a lot of the heavy lifting that we could have nurses doing or running groups and a lot of the things that we talked about. It's perfect for nursing and providers are getting burned out doing it.
A few physicians that went up to us and was like, I would love having nurse coaches because they make the clinical handouts, but then there's no one that actually does the follow up and the coaching and the guidance with the patients.
Yeah.
Yeah.
I would love it if you could share for everybody more about your background and what brought you to where you're at now in your practice.
I know as when you said 18 years, I was like, oh, that's aging me. Yeah, I've been a nurse since I was a baby nurse. So I was been a nurse since I was 23
Mhm.
as an RN. And I was on the cardiac step down floor, which was a lot of heavy lifting,
Yep.
lots of education. And during it, I did injure my hip a little bit. So I always knew I love bedside, but it can't be long term for my body. So I went back to becoming an NP. And I've done everything because, as you know, I always have like 3 jobs.
Yep.
So my NP career was multiple things: hospitalist, pulmonary, primary care. And then I went and started urgent care, then aesthetics and functional medicine because I just love learning. And I think that's how we grow as human beings. I don't let my ego get in the way. I just want to keep learning and learning all the different fields so you can be the best providers for the patients. Yeah.
I think that that's something that we all have in common is just never being satisfied with how much we know today. Can you imagine if we just didn't get to keep learning more about this? It's so fun.
Yeah, it's so fun. And then as a nurse, you can do that because not every field you can, especially in primary care, even if as an NP, you can go and become an aesthetic injector. You can become labor and delivery. You can become cardiac. Yeah, right? You can really jump to many different fields if you want to learn more.
And layer things too. And I always tell students when we're in meetings, you're never going to be bored again. Once you find functional nursing, you could never be bored again because there's always going to be something.
Yeah. When I started really practicing functional nursing, I realized that you actually have to be a specialist at multiple things. Because before, when you were doing primary care, if there's a skin issue, you're like, oh, refer to derm. If there's a mental issue, refer to psych. But when you're doing functional medicine, you wear all those hats, right?
Yeah.
And even, of course, if they have really bad CAD, you're going to send them to cardiology. But prevention and teaching about high cholesterol, all those things starts with you. And really, when I did start functional medicine, I was like, oh, wow, I can never be bored because I have to learn about all the specialties and then weave it together for the patient.
We were just talking about using analogies before we hit record and just making things relatable for patients. I really would love for you to share. So you practice functional medicine, you practice aesthetics, you've mentioned seeing that clientele wanting, they're not separate businesses in that people are coming and they're getting things done and they have questions about their inside of their body as well. I always tell students if they're thinking about skin, it's a reflection of their gut health, their internal health. And I know you have a lot of thoughts about that and how it plays out in your practice. So I would love if you could share a little bit more about that.
Yeah, I started noticing it maybe 2 years ago because not just at the functional conference, but also at the med spa conferences, that they're starting to implement functional medicine, which is very exciting. I think being an injector, have your really great relationship with your patients and they trust you, right? And so that is where you can really talk to patients about, hey, your hormones are changing. That's why your skin is changing. Or hey, you keep getting the psoriasis or eczema and maybe it's your gut, right? So it's an exciting place to see them both of my worlds go into one. I just want to make sure it doesn't lose integrity because there's a lot of practices that are not functional certified and they kind of took one class and now they're doing functional medicine and it's more superficial, but it's an exciting field to see to for both of them to collide. And I'm really trying to see what else is going to start blooming out of that.
Yeah,
Yeah.
and I did an episode on that topic that you just mentioned recently where people think they're going to see a functional medicine practitioner and they're not, right? It's somebody that is a buzzword and maybe they did take a weekend course or one course and they're offering it. And could you share a little bit in your words of the difference between a short course and saying that and just incorporating it into something like aesthetics, where I could see it being a lot of supplements and maybe the testing without the deep dive. But what are you seeing in your practices?
What it is, I think when I'm at the conferences, they're like, "Oh, I'm going to teach you functional medicine." And then I ask them, "Okay, well, what is it that you will teach the med spas to implement?" Or it's very, "Oh, it's peptides, pellets, hormone pellets." And I understand that those are very helpful to a degree, right? But it doesn't really get to the root cause. Oh yeah, you have hormone imbalances. Let's put in testosterone pellets. But you're not really deep diving. Okay, but why do you have low libido? Is it high cortisol? Are you not sleeping well to naturally make testosterone? So it's really just jumping to like, here's the quick fix still is not
Mhm.
giving patient the foundation and the tools for them to fix it themselves. And so that's what I see is it's still very superficial because functional medicine itself takes so much time,
Mhm.
right? Changing habits takes time. But that is where the heart is in functional medicine. That's what is needed. But I don't see that yet in a lot of med spas. It's still very superficial.
I think the way that we referred to it when we were on the trip is all these things that are functional medicine adjacent. And it's easy to have them in the same practice, but then that doesn't make them functional medicine, or it doesn't make it a functional medicine practice to be like IV therapy comes up a lot with students where they're like, "Oh, I work at a functional medicine practice. We give IV therapy." And I'm like, "Well, that's not functional medicine. It's functional medicine adjacent. It might be complementary, but it isn't functional medicine." And that exactly what you said, doing the deep dive, figuring out the why for that person, and that takes time. I'm thinking of that analogy of, like, you just said, being an injector and having that trust and close relationship. It reminds me of talking to students about, like, you might be a massage therapist and a nurse and offer 2 things, and I'm like, "But you're probably not gonna massage people and do a functional medicine intake, right?" And so, maybe these clinics do offer all of those things, but they might be in separate visits or layered in a way that fits well for that niche or that specific population of people.
Yeah. And IV therapy is a great example because people are like, "Oh, I don't feel well. I'm going to go get a Myers cocktail at my med spa." That's great. Why don't you naturally absorb food? What's going on with your gut, right? Are you making enough digestive enzymes? You should be able to absorb food for your mitochondria to work effectively, right? Why do we need to bypass that and give you IVs? And sometimes we don't know you have MTHFR gene and you need methylated B vitamins, right? And then what are they putting in those IVs? Is it methylated yet for you? So it's all encompassing. Of course, um, if the med spas do it correctly and they do it right, and the people are certified and they have the time, it would be a great system.
I agree. Yeah, yeah, having it where it fits in well and that there is real time set aside for it because it isn't something you can cram in during, an aesthetics visit where you're doing a lot of really technical
Like doing
things
your
and
Botox and about your hormones and how you might be recycling estrogen through your stool. There's no time to really deep dive like
yep.
that. Yeah.
And that ties into something I was gonna ask you, that I know that you feel really strongly about helping your patients understand their lab results, the story, connecting it to their health, what's going on inside their body. And I would love if you could share why you feel like in your practice that piece is so important, and it really highlights why you need that extra time.
Yeah, I think that's why we're in healthcare, right? We want to promote long lasting changes. And from a conventional model, working in urgent care for 8 years, people love quick fixes, but then they're back again, right? And if we go to a functional model where we think that we're okay, I'll just give you a quick fix, but not really spend the time to give you the right tools for you to change your modifiable lifestyle, right? Then we're actually just doing the same thing as conventional medicine. So I feel like we have to spend the time, teach patients the right things so then they can understand when they are doing certain habits, this happens to their health. Or be more aware of your symptoms. If these symptoms appear, oh, then maybe I have too high of a toxic burden. I'm overloading my body, and I need to work on supplying it for the demand it needs. And that's what I really want to teach people is like, where are you in your life right now? What is your supply and demand? And what tools do you have? So you can know how to really fix those things on your own as well. So it's not just a quick fix, here's a supplement, which some people think that's all it takes.
Takes me back to I worked on a cardiac step down unit just like you. Back to those days of all that was a very education heavy floor, and I'm thinking about the way that I approached educating patients and what I taught them and the skill set I had then compared to now, and how that is what really led me to initially going to NP school and feeling like that would be the thing that I was missing, and finding that, like, learning functional approaches is actually what I was looking for. I wanted better answers. And so I feel like that really, as nurses, we all have that idea of approaching our patients holistically, but it's like one of those scenarios where we don't know where we don't know, and you learn it and you're just like, "Oh my gosh, like, I wanna tell everybody." And I feel like it really restored my energy and passion for my career to learn it. Could you talk a little bit about what it's meant for you and your career to learn functional medicine?
Yeah, I completely agree with that. I think it really did spark my passion again. Oh my gosh, these little changes I can tell people to implement every day makes a huge difference on their lab work, on how they feel, on their health. Just for instance, let's talk about high cholesterol because we're both cardiac nurses, right? Oh, your LDL is 130, and we really deep dive into your APOB, your LP little a, all your genetic risk. But when no one's sitting there and has the time to talk to patient about diet, how much fiber are you eating? Did you know if you eat more fiber, it will lower your cholesterol? What's the perfect amount of fiber? And just those things, how to calculate your fiber. Just something simple like that can help lower people's cholesterol. But there's no one teaching them that food is medicine.
Yeah, definitely. And I wanna hear more about your shift to becoming an entrepreneur. Was that, like, born in the time that you were becoming skilled in functional medicine, or have you always had that mindset of, like, being a business owner?
Well, I think kind of my mom's an entrepreneur. I fought it for a long time because I see that it's pretty hard, it's very challenging growing up having an entrepreneur mom. It's really, I think it's in me when I saw that I didn't like the way conventional medicine was kind of just sick care. And I wanted to really see how I can build a practice to support patients and have those long lasting habits for them. And it was really hard to do in the conventional model, especially urgent care. It was scary at first, right? When you first become something you're not used to, having stability, a 401k, insurance, those things,
Yep.
it's scary to let go, right? And it's still a learning curve for me. For a lot of entrepreneurs, you're going to have great months and you're going to have slow months, but then it all kind of evens out.
Well, and that too, just like function I think you're never bored when you own your own business too.
Yeah. Look, you're never bored, and it's going to come with challenges, and you're going to grow. And then you learn you have to delegate, and you got to learn to trust yourself. And then you got to learn to trust your team because that's how you delegate. I mean, just in the beginning, I was trying to do everything because I want it done right the way I do it. And then you realize then you're not it's not scalable, right? Yeah.
Yes, yes.
But it's always scary at first to start something different, a different role that you're not used to. Like, you in conventional medicine, you're used to having a front desk person. You're used to having a medical assistant. And they do a lot of things for you. And when you're on your
Mhm,
own,
mhm.
like, oh gosh, I have to do everything myself.
My students, I tell them anything you can automate when you're first starting out and you're on your own is key. But I think that is the answer I get from the most nurses and nurse practitioners I've talked to, because I've had that kind of conversation a ton, and just like what brought you to becoming an entrepreneur and motivated you to do it. And it typically is like, I wanted to offer something different that wasn't available in my setting I already worked in. And a lot of them will us as nurse practitioners often have to worry about non-competes. And so I've mentioned that before in the podcast where you always want to make sure you don't have a non-compete. That's generally nurse practitioners. I think our state, Washington, just made them illegal, which is cool. So nurse
Yeah,
practitioners don't have to worry anymore.
for you
But
too. Yeah,
good, good. Yeah, I think more and more states are doing that where we don't have to worry about it, which it limits patient access, so it shouldn't be an issue to start with.
right. Yeah.
But nurses can absolutely, I use the example all the time, and I know that, but it's and I know that you can relate to this example too, is cardiac rehab nurses are the ones seeing the patients when they discharge after open heart or an MI, and they're in there, supporting them in those visits that are staged over time. They develop a relationship with them, and those patients are often really motivated to address their health in a way that they never were before that heart attack or that big surgery. So, several of my students now have either created group programs in their cardiac rehab world, the clinic they work at, advocating for, let me support these patients in group settings. But a lot of them have been like, I don't have a non-compete. So they start their own practice on the side. And those patients that want all that deep dive and support and education, they get to support them in their own practice as well. And there's nothing like it.
And I love the group program concept because then you're also helping them build a community and new friendships, and they have each other to support, right? Part of the blue zones, what keeps Centurion alive, one of it is community. So it's good to see nurse coaches developing time, helping that community grow, because that really just helps the patients as well, because they'll find each other, friendship. Yeah.
Yeah, and, we were talking before we recorded about our community that we have,
Yeah.
that's growing, and you said early on that this can be lonely, if you're doing it in your own community and you're the only one, and so it has been so great to have the community grow and inside the membership, and then us being able to connect in person. I just shared all the dates the other day of when we're gonna be at conferences and having booths and, like, or being attendees or both coming up, and just opportunities for us to be together in person. I think it's just so important. Like you said, it's important for our health.
Yeah. And I see it even with my patients, just if I do a GI map and they have really low digestive enzymes, and we just work on like chewing carefully into applesauce consistency so you can make stomach acid, you can make digestive enzymes. And I hear them say, "Oh, been practicing it with my significant other and my kids. And now we're all mealtime routine is together, and that's their community. So if
Mhm.
we just think about growing a community like that for everyone and they're supporting each other, it's really going to create that long lasting habit.
Yeah. You're reminding me of when we went to eat with my sons, and we were all at the table, and Chip's like, "You guys are excellent chewers. You have really good eating hygiene." So you really do pay attention. Okay, can you share from your experience while we're still on this topic of entrepreneurship, maybe your biggest what is the thing that has been the most challenging for you or that you've learned from in, like, Chip before she owned her own practice to now? Like, what do you feel like has evolved and you've learned?
Well, I've learned boundaries is important
Yeah.
and time management is important. So, and automation really helps because I think first off, when you are doing like your initial consult, your clarity discovery calls, you want to make sure it's linked to your Gmail or something that you see every day, right?
Mhm.
Because then you're not double booking or, you're more organized. And then I'm a pleaser, people pleaser. Um, I didn't know how to build boundaries with my clients as well in the beginning, but then now I do. I have an automated text. So when they text me, it automatically sends them a text. Chip only checks at 1 p.m. and 4 p.m. So it sets
Like
expectations.
that.
They can't text me at 11 p.m. because I won't be checking it, right? But just building boundaries and time management has really helped because then I don't feel like I'm getting pulled at so many different directions and overwhelmed as the beginning.
I was in a meeting with the entrepreneur students the other day, and we were talking about how, like, a lot of things in your business, you get motivated to address for like things you need to solve at the beginning. Anything, opening a bank account or automating all the paperwork that needs to be signed by the patient before the first visit, like all those types of things. And we were talking about how when somebody signs to work with you and they're on the books, that is a really motivating thing to get you to like, "Oh yeah, I gotta figure out my intake process," or "How am I gonna get paid? Where's that money gonna go?"
Yes. Yes, the intake process. Yeah, that got automated too. In the beginning, it wasn't. I was manually going in there, sending them the consent form, sending them the initial intake. But now it's like when they book, they pay, and those things automatically get sent.
You also mentioned before we hit record, we were talking about electronic health records. And I know the one I use, that's one of the things I love about it is I can integrate the calendar and schedule. And it worked for the type of practice I had envisioned. That was exactly what I needed, where I've had students say, "Oh no, I have to have these features because of my niche." And you were talking about how having that overlap makes it totally different for you, because I always say, like, I love practice better because it's great for, like, that coaching, functional nursing model and providing a ton of content and information after the visit, getting paid and scheduling, and automating. So those are, like, the big things that I think are benefits of that platform. But you have different things on your mind, so I'd love if you could share what are some of the big things you have to think about when you choose one?
For me, I wanted something that can incorporate Whoop and Aura Ring and with things their scale, right? So I use Biocanic because they were able to incorporate so many different modalities. Like I want to see how they're sleeping, right? That's and then they also have automation, which is so important. Now that's why when they book and they pay, they pay through Square or Stripe. You have those options, and then they automatically send stuff, the welcome email and what to do next. So that's why I picked Biocanic, and also you have to think of your budget. I think when
Mhm.
you first start, what is your budget? Like, how much do you want to pay annually for your EHR system, right? Because then it goes into you can buy Serbo, it's $300 a month, or you can buy Biocanic and it's $50 a month. And the next question I would ask is, do you want to prescribe medication? Because Biocanic Practice Better both is implemented with full script, but are you going to only do supplement? Or are you going to do supplement and medication for the NPs,
Mhm.
NPA?
Mm.
And if you are, then you want to find like a system, an EHR that can incorporate that for the budget that you're on.
Yeah, thank you for that. And I think too what you need to document, like in aesthetics, the way that you document and what you're documenting is so different than somebody that's like running a kind of a coaching model or a group model. And the thing that I recommend the most is thinking about, you mentioned several factors. What is it really going to look like when I have patients, and what are the things I do need to do with most of them? Because if you don't think that through ahead of time and you sign up for one that seems great and then you go, "Oh my gosh, it doesn't even do this really important thing that now I have to do manually for every single person." Changing is really challenging, and switching.
Exactly. If you pick the one that you like from the beginning, you don't have to transfer all your patient's data over to one later on. Is going to save you time. I definitely agree, Rich, automation and the group setting and how aesthetically pleasing it is for patients too. That's important. Budget and if you want to prescribe medication or not.
Yeah, those are big, yeah, and I think when I first started using Practice Better, it was a really long time ago, and, some of those things weren't features then, and so it was a reason that people didn't use them at the time that they have since listened and addressed. But there was a point where, like, some of my students were like, "Well, I can't use that one because it doesn't offer prescriptions or, things that were really important." One that I think is a really unique thing that is a good example for people listening is one of my students does home visits as a pediatric nurse practitioner, and she goes to homes of perinatal window time. So right around the pregnancy and after delivery home visits. And she's like, "I can't use Practice Better because I have to have growth charts and all the things to track the baby are so important in my practice, and it would take me forever to have to do that somewhere else and move it over." There are really unique things about all of our practices that might make something a very important feature that isn't even a priority for somebody else at all. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. And if you're looking for connection and real time learning, the functional nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode.
Yeah. And also think about how much work you want to put in your intake forms, right? I picked bioorganic because their comprehensive intake form is very similar to the questions through IFM. And that was important for me because I didn't want to build my own intake form from the scratch if there's already one out there, a template. So there's a lot of templates that you can steal from Biomechanic that is very similar to the Institute of Functional Medicine questionnaire. Because I did try Practice Better and they didn't have that. So I had to manually type in
Mm-hmm.
all the
Mm-hmm.
questions, and that was just very time consuming. I mean, same thing with aesthetics is you want to pick something an EHR that already has the consent forms for microneedling, for Botox, right? And it's just a template you pull over. So you want to think about like, okay, if I'm starting my business, how much time do I have to make my own consent forms and my own templates? Or do I want something that has those things already and I can just pull from and edit? Because that's important too.
Yeah, and you can trial a lot of these and go
Yeah.
in and see what they have. And I remember some of the very first cohorts of the program that I used to teach that I had built what was very similar to IFM's intake for me in Practice Better because at the time there wasn't one. And since then, so the students would always be like, "Can we have a copy of yours?" Or, "Can you show us?" And now, thank goodness, there's one built in there so they can just access it. But it was very time consuming. Doing a free trial of an EHR and just I know we're down a rabbit hole we'll get out of in a sec, but just do a free trial and look at the templates because they can be so time saving.
Yeah, and that's really important. Like if you're gonna for that pediatric NP, her templates and her forms is not going to be in a lot of like Practice Better, even Biomechanic. She has to build it, but if she builds it and it's safe in their library, that also helps everyone else because then we can pull from it for the next pediatric NP that does that, right? So that's important for you to decide from the beginning. Also, when you're trialing it, how much support will it give me as I evolve in my practice?
And, the last thing I wanna talk about a different topic, but I wanted to ask you or say first something that we were touching on a little while ago was, the learning from onboarding those first patients. And you were talking about boundaries. And I was thinking in that meeting with my students the other day about the first time I had a patient that was blowing up my app between visits with messages. And I was like, oh, I got to learn what hours do I answer messages and what do I say between messages and what is my policy between visits of how much I'm willing to answer versus needing a new visit. And a lot of those things come up as you build your business and it's the first time you encounter them and you're like, "Oh, I need a solution for this, but I want to figure out a way to do it that's automated and addresses it ongoing instead of each person, having to
Yeah.
have that conversation."
Oh, absolutely. You're right. That's very important because now I have it in our consent form. If you cancel not within 48 hours, there's a fee. Not everyone does it. I don't really take it, but it's there just so people understand they value your time and you value their time. Right. And also setting expectations from the beginning. So then your patients know and you know. So, because it's not fair if you're doing a visit and someone's texting you all the time because it's a disservice to the patient in front of you and also to the person texting because you don't have undivided attention for them, right? So it's good to set expectations in the consent forms that are automated that you send out. Like you can say when you have an email, I have 24 hours to respond, right? If you have more of a concierge care model like me, then you have those automated texts that comes back when they text. Chip only checks 1 p.m. and 4 p.m. and her business hours are Monday through Friday, 8 to 5. So they know when they're texting you on a weekend, you're not going to text back.
Mhm.
Yeah. So
Yeah.
yeah, those things are important to set expectations at the beginning. And I think everyone has a little bit of imposter syndrome when you first start something new. I think at first, when I started my packages, I used to do our like initial visits this much, and now I just have packages. And it's kind of imposter syndrome. Like you feel like, well, that's a lot to charge patients because you're going from an employee paid job to an entrepreneur job, right? And you have to keep in mind when you're in an entrepreneur job, hourly is different because you spend all this back end work reviewing their labs and their history and their intake, and then you see the patient and then you spend another hour doing their functional matrix and everything else. So it's not, if I'm charging $600 for my initial visit, it sounds at first kind of like imposter syndrome, like you're not worth it, and that's very common to have.
Mhm.
And then you realize that, yeah, actually I'm putting in all this work and it's fair. At first, you're going to feel like, oh gosh, I'm asking for too much. Yeah. In the beginning of your business.
It's like it's a requirement almost like a rite of passage to deal with your imposter syndrome.
Yeah.
I mean, it doesn't go away. I think it just evolves with us as we keep growing in our business too. You made me think of a topic that I don't think I've really talked about before that when maybe we talked about it on the trip. I think we might have talked about it a little bit. Is I was talking to some conventional peers recently, not long before I saw you, that the idea of they felt like it's not right to message. So if you see a patient and you order lab work, you should be messaging them between visits for no additional charge to tell them what the results are. And my opinion, and it's been this way before I was a functional practitioner, is when I was in primary care and my patient's in the exam room and we're talking about our plan and follow up and I'm ordering labs. And then I'm like, stop at the front desk and schedule your follow up and do your labs at least a few days beforehand so we have the results. And then we can talk about them at your follow up. And then we'll adjust our plan based on those results. When you learn billing and coding, so RNs that are listening may not really think in those terms, but when you learn billing and coding, you have to think about your decision making model and how much decision making when you bill for a visit. And so new information is going to inform maybe some changes to their medication or their plan of care or when you want to see them next. It's 100% justified and the safe practice to be able to ask more questions and spend time with the person again. And they were like, "No, no, 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 you basically already did that." But I think it just turns into more messaging between visits, which I think is more risky, right? Just answering a quick question without more follow-up. I think in our model too, it's just so much more information that we need from people to really give them personalized information.
Yeah. I mean, when I was doing urgent care, I would charge a 99214 for 15 minutes, right?
Mhm,
And
mhm.
that would be like 158 or $300 for 15 minutes, right? But that's the insurance model. So it's like when you try to build your practice, you have to think also all that decision making process, the complexity of the patient, how much you had to review, how much time that all goes into how how much this visit is worth. And when I order labs and I do a follow up, I always do a charge follow up because I had to sit down and go through your labs, go through your meds and your supplements, and we have to spend time and really talk about it too. So it's the same medical decision making. It would still be a visit to me.
Yeah, I think so too. I feel like the other mindset is like in urgent care is a great example. Is bacterial infection not right? CBC is just so black and white
Yeah,
in that world, right? Where for
right.
us, it's let me look at this for a good 3 or 4 minutes and think about that patient's story and maybe go back and read a note
Yes, yes.
and be like, oh, did they say that they had this? And then be like, oh, yeah, no, but they're on this medication too. When did they start that? You have to really have created space to do that.
Oh, absolutely. For instance, hormone follow up. Okay, you're on estradiol and testosterone and progesterone, right? But okay, I only checked hormone labs for to follow up, but I also have to go look at your previous Dutch. How do you metabolize hormones? And then I have to look at your previous FSH, TSH, all those things, and then go look at your MSQ, right? So it's a lot just to go over 5 hormone labs on medical decision making.
Well, and I think it ties back into that imposter syndrome too, that nurses that and nurse practitioners that might be struggling with charging for their time,
Yeah.
recognizing this. It does take time, but also people can go get that 15-minute visit in an urgent care or primary care and not get these types of answers and this type of work, but people want it and somebody needs to offer it, right? It's up to us to get over ourselves and
Yeah.
just offer it, right?
Yeah. And honestly, if it's low iron and ferritin, and I started them on Heme Bite and fix their gut, and I only check low iron and ferritin again to see if it's high, I'm not going to charge them for that, right? If it's something that you feel ethically like I cannot do that, of course, you're not going to charge them. But if it's hormones and I'm checking all these things and these other specialty labs and your lifestyle, it's at least a 30-minute visit, then I would charge. Yeah.
So, something I already know I would love for you to just share your thoughts on is when patients we talked about this on the trip too, is the, idea of Dutch being the best test, right, that you can do, and then we were talking about what it's like in the real world to take what we learn as, like, the gold standard of the way to do things in functional medicine, and then the reality of working in the world that our patients live in as far as, like, insurance or cost or time demands or all the other factors that come into using some of the more expensive versions, and so I would love for you to share a little bit about that.
Yeah. So I think you always have to meet people where they're at, right? So if you become really comfortable in your clinical decision making, you start seeing patterns. You're like, oh, that person's estrogen dominant. That person is probably pushing 16 pathway or pathway on the Dutch. And if they're on a budget, then you're not going to order it, right? Because you know enough. These are the patterns I see, and the test will probably say this. And if you can't afford it, and I'd rather you spend that money and buy certain supplements or more cruciferous vegetables, whatever it is, then I prioritize that. I always meet patients where they're at. I'm not like, you have to do this and you have to do that, because you are the clinical expert too. Oh yeah, if it looks like a duck, it's probably a duck, right?
Mhm, mhm.
Yeah, and that's when you have to start trusting yourself also. I think in the beginning when you first start anything, it's like you don't trust yourself, so you order many things, right? And after a while you see a pattern, then you're like, oh, okay, that's probably estrogen dominant. That's probably pushing the androgenic side because she's losing hair, right? So you
Mhm,
don't
mhm.
have to order it. But some patients also want to see it. They're data driven, right? So I tell them, okay, you have this budget, but also if you want to see what's actually happening, then we can do the test. This is what I think is happening based on your pattern and what I see. But if you want to know for sure, we can always do it. And you have a budget for it, sure. Yeah. So I give patients like options, but be really honest about what I think it is and what the test might show. And some people really like to see it. They're very data driven.
Yeah, yeah, that's how I feel too, and even if you might have a good idea of where to start, which I often, like, talk to students about, there's no reason to start with a Dutch test if your patient's constipated and dehydrated and
Yes.
eating a
Yeah.
crappy diet, right? But sometimes you're gonna have a patient that needs the test result or they are not changing anything.
Yeah, and sometimes it's, oh, I just kind of, you look like you're in adrenal exhaustion and maybe some HPA axis issue where I'm like, okay, let's just do the cortisol diurnal. We don't have to do the whole Dutch, right? But some people need to see that for them to implement change. So I always meet people where they're at, and I'm really honest about options. Yeah.
Yeah, I think nobody's in more denial than females super stressed out, holding up the whole universe, and then they're like, "No, my stress is no big deal," and you're like, "Okay, well, how about we see it
Yeah. You know
on paper?"
who I see a lot where data really hits home is my male patients. Because a lot of them are like, I'm fine.
Mhm.
Everything's fine. I just don't feel well. And I'm this and this. And like, why can't my testosterone be higher? And maybe just give me testosterone, right? But like when they actually see their labs, like their functional labs, right? That is where they're like, oh, okay, maybe there is something wrong.
Mhm.
Maybe I got to fix this. Yeah. So it just depends on what resonates with your patient. And that's what your initial deep dive is about. You're going to learn what kind of learner they are, right? Because you're going to learn, well, this person is very analytical, right? Like my engineering patients, they like data. They want to see it. They have an analytical brain. So that's the conversation you're going to have to talk to them with.
And I don't think it takes long to figure that out with people
Well,
too.
no.
When they start telling you their story and they have their labs pulled up on their phone and they're like, "And then I did this." Okay, in the time we have left, I don't wanna forget, I know that you feel strongly we've been talking about entrepreneurship, but you feel strongly about team-based approaches and collaborative care, and so I wanted to hear some about how you feel like the team really impacts patient outcomes and where nurses fit in that story.
Oh, yeah. I mean, doing this for the hospital, we have uh, 8 nutritionists at the time. We had health coaches, we had an exercise physiologist, and patient felt really supported because there's a whole team working for them. And although I know nutrition, I don't know it like a clinical nutrition specialist who specializes in functional medicine, right? And although I understand exercise is good, I don't understand it like an exercise physiologist, right? And then for my health coaches, this is very similar to a nurse coach. Is a clinician gives you all this information, all your labs, and then the nutritionist tells you you have to eat this and you do that. But no one's helping you prioritize what are your goals and how do I become your accountability partner, right? So that's why the team-based approach works so well for us is everyone's hitting different subjects for the patient and they're supporting them in different ways.
Yeah, I agree. I think that, nurses such an interesting thing that, like, comes up a lot is, like, nurses don't even think about having their own business or they wonder if they're even able to, and a lot of my students have built a practice of their own as a nurse. That doesn't mean they're just working in a silo. Most of their patients are also seeing other people, and it is part of a team even when you are in your own practice. But I've heard more and more the practices that are bringing nurses in, especially if they have coaching skills and having them support the patients between the visits with providers and like we talked about earlier, group visits. It's our role right now at IFN is we're trying to make more of the integrative and functional space aware of where nurses fit in here and all the problems they solve. Because it's really exciting for us to think about, but like nobody else, it hasn't occurred to them yet.
Yeah. Well, I think also repetition for the patient. Because
Mhm.
at first, when you hear information, it's overwhelming, right? First, you hear it's an hour and a half visit. You got to know about me and these are my labs and what's wrong with me and how I can fix it. And then I see the nutritionist, she solidifies the goals and the plan and what I need to eat. Then I see the nurse coach. Then she really, because actually, I think nurse coach is going to do a little bit of both, right? The nutrition and the health coach part. And then there's more solidifying and repetition. So, because then the patient really understands why they should do certain things. Why should I walk after I eat? Because I'm pre-diabetic. Why is that important? Right? How to put on a glucose monitor, how to read the glucose monitor. All those things nurse coaches can do and they're so powerful for patient to understand, but we don't have the time even after an hour and a half visit to explain to you what your glucose monitor should look like.
The partnering with them and those little because those are all the things that fall through the cracks. If a provider just says, "Oh, go wear this," or "Go eat this," or "Go do this," that's when the patient comes back, they're supposed to come back in 3 months and they come in and they're like, "Oh, that referral didn't go through," and you find out that nothing that you planned for at the last visit actually came to fruition because there were challenges or there was no follow-up or accountability that, like, is a perfect spot for nurses.
Yeah, especially like GI protocols. I find patients find the group support the most helpful for GI protocols. Phase one, we did part of the 5 Rs. Phase two, we do the other 5 Rs. And the nutritionist helps guides you to that. But then also my nurse coach or health coach really solidifies it because they get overwhelmed with like, what supplements do I take? How much water to drink? How much fiber to eat? And then someone can just be there and help them prioritize.
Yeah, because especially if you're doing a lot, they're gonna have questions. I don't remember the exact number for when we have just an average conventional encounter with a patient in a clinic or hospital, the percentage that they actually retain a day or 2 later is
Yeah.
just so small, and so if we're asking them to do several things and there's no follow-up, they're so much less likely to be successful.
Yeah, and I think that's why team-based approach is so important because that helps them with their to-do list, their follow-up. It keeps them accountable. And they feel supported and not overwhelmed, the patients, because you're there with them week by week.
Now that you're like, so you're faculty with us, you're, as I mentioned, teaching in the program, but also coming into the membership now to be part of our faculty there. How are you feeling about the future of functional nursing and them moving more nurses coming to this space?
I think it's great because we are the largest task. And if we envision a world where primary prevention is key and empowering patients, that's where nurses really shines because we're always the frontliners. It's an exciting space. And I'm really passionate about teaching everyone about functional medicine and the tools you can give to your clients because it's going to grow and I want it to grow right. We talked about this in the beginning where there's a lot of people doing functional medicine but they're not trained correctly, right? And it's kind of a disservice for patients. It's kind of wild west, really.
It is. Yeah.
Yeah.
That's a
Because
good way
you
to
have
put it.
so many different types of clinicians doing it, but not everyone is doing it correctly and right for the patient. Yeah.
So we were talking earlier about getting back to beginner's mindset as faculty, how we have to remember what it was like to first come to this. What words of wisdom can you share? This is a nurse or nurse practitioner's first episode, and they're just finding out about functional medicine or functional nursing and thinking about adding it to their toolkit.
It's always um, a great starting point is what you're really passionate about, right? And what hits home. What's your niche? And it was always hard for me because I love everything about functional medicine. I like autoimmune, I like hormones, I like gut. But if one thing really resonates with you and you're just starting, is like, oh, I had Hashimoto's. And that really resonates with me. I saw how functional medicine helped me or my patient. Then really, really go all in on that to start. And then you can then expand, right? So then you can be a specialist at that first before you move on.
Yeah, that's a good I think I tell students when we talk about niches, being a generalist feels like the right move most of the time. People think, "Oh, especially if I'm starting my own practice, I should try to help everybody." And we talk about how from a marketing standpoint, that isn't the best approach.
No.
But also
Yeah. And same thing when you're on Instagram. And if someone's talking about like thyroid pharmacist, all she talks about is the thyroid. You
Mhm.
want to follow her because all she talks about. So if you're a hypothyroid patient or a Hashimoto's patient, you're going to follow her because that's all she talks about. So from a marketing standpoint, absolutely. Yeah.
And it's I think it's really getting into a niche. You can change whenever you want, like you said, but getting in there and getting really, really good at something very specific. I've been using fertility as an example a lot lately. You can get really strong at that as an RN and support patients in a really unique way that isn't available anywhere else in healthcare. And you can, I've mentioned in a recent episode, one of our students had several women report getting pregnant after working with infertility clinics for several years. And then they worked with her as an RN and she had several people in 1 week writing that say they were pregnant. And it's so exciting, to think,
So exciting. And in the future, they can partner with midwives.
yes, yeah, yeah. Okay, my last question for you is just in when you think about where we're at with healthcare in this country right now and the potential for the functional approach, how are you feeling about what we have to offer and where healthcare needs to get for us to take better care of people?
Well, I think if we can train more nurses to spread the functional medicine love and
Mhm.
even these group community visits, it's really going to change healthcare in general. I think more people will be healthier and less sick and less reliant on medications and more side effects if they just have the right tools and if we can teach them those tools. And nurses, we talked about the functional matrix is very similar to our nurse concept maps
Mhm.
when we were in assessment and plan. So it's really rooted in us, and we are the one to do it because we're the first person that the patient sees. We're the one educating patients in the hospital and outpatient. We're the one that we have the time to sit down and spend it with them and give them these tools.
Yeah, I agree. And I think it just needs to be more and more of us to realize it. And I think that's happening from the time that I first heard about functional medicine till today. It's just like changed so much. Like
Yes.
how much people actually like know what you're talking about if you
Yeah.
say that's what you do.
Yeah. Even when we were cardiac nurses and we're teaching them about low salt diet and fluid restriction and walking and all those things, right? It's like we are destined to really do this, to be the front line, to be the teaching, to guide patients. So I'm
I
very
think we're the right profession for it too. Like, it's just nurses in particular being able to spend time with people and teach them and follow them. Okay, Chip, this was so exciting, and I am really happy that you were able to come on and share with us. When I first had realized I want all of our faculty to be IFMCP certified nursing professionals. Like, this is gonna be for nurses by nurses. You were the first person that I connected with, and I was so excited to get to know you and then to get to hang out with you in person. And today I'm just so happy to get to introduce you and all your expertise to a bigger audience of nurses and nurse practitioners. So I'm really grateful for you.
Thanks for being our leader, Bridget. We can't do it without you. You're amazing.
We're an incredible team. I think we're all so lucky.
Yeah, we're all lucky to have each other.
So I'm going to share a little bit of your social media and stuff for people to be able to follow you. Of course, now if they join the program, they're going to be able to come in and connect with you in the membership and learn from all your wisdom. Thank you so much for being with us today, Chip.
Thank you, Bridget. I'm very excited to start. Can't wait to see all the clients and students in our program.
Yeah, definitely. Until next time, everybody, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.